So, hey guys, welcome to another one of these social proofs that I think it's really important to let our partners communicate what it is that we do. And today I am with Dr. Parrack. She's a vascular surgeon in Florida. How you doing, Dr. Parrack?
Hi, good to see you.
Good to see you too. Thanks for doing this. Just give our viewers who don't know you just a little bit of background about yourself, about your business and what you do.
We're a pretty bread and butter community practice in vascular surgery, except that we try to bring a very high end. All of us in our private practice of six surgeons, we've come from pretty diverse areas and backgrounds, but also the training has been at the highest caliber. So we're trying to bring together that academic and high level cutting edge medicine to the rest of the community so that not everybody has to drive to the center city like Tampa, et cetera. So we're located in Sarasota, and we're very well known for our excellence of care.
Excellent. So, what challenges or problems were you facing before you actually started working with Paramount MD?
I think one of the biggest things that most people don't know is they don't know what a vascular surgeon is. When you say you're a vascular surgeon, even my own parents, they think I just take some veins out, or they have no idea what it means when they say, you had a stroke or you need your carotid artery cleaned out. They think they need to see a heart doctor. So a lot of these things get very confused, and people don't really know when to even come see us. This is also the case for even sometimes referring doctors. They don't really know exactly, for example, for dissections in the aorta, where at what point do we take care of them versus the CT surgeons, which are cardiothoracic surgeons. So I think this really, working with you guys sent a very clear message as to what is important, what we do, and what are some of the things we can do to help the community.
Working together, what did we actually do with you?
Yeah, so a couple of things. I think one of the really cool, fun things we got to do is have you guys come over and get to meet some of our patients and get some testimonials so that our patients can really, in their own words and in their setting, and you guys even went out to their homes, be able to talk about what scary things that they have encountered and why, they came to see us and how they came to see us and what were some of the, things that we did for them that were life-changing and benefiting them. And I thought that was really fun and cool because, we rarely get to kind of see the patients outside of this environment and, have them be in their own clothes, be with their family and get to know what that's about. So that was really fun. The Whiteboard Wednesdays, I thought that was really powerful. So, I never get to give these mini lectures. We usually have some lectures in the community where we get like a whole hour to try to cram in so much information to people that at the end of the hour, most of the people, they come back and they come talk to me and they're like, that was great. And then when they try to ask me questions, you can tell there was just way too much information overload that they have a hard time, taking that apart. So doing these short Whiteboard Wednesdays where we can really concentrate on one little topic at a time so that it becomes absorbable bites for patients, I think that's really amazing.
That's cool. So talk to me about like your experience working with me. I know I'm the videographer that was down there and the process.
It was fun. I've never done something like this before, and I don't usually think of myself as being comfortable in front of a camera. I'm comfortable giving lectures because that's what I'm used to do, teaching, but I never have to usually watch myself and see, what my facial expression looks like, a month or two down the line when everybody looks at it. So that was in some ways a kind of a daunting project for me, but you made it seem very comfortable. I mean, I've had this experience when I was getting my wedding photos taken, where sometimes some people makes you position in a way that you just feel very uncomfortable and awkward and you're not yourself. But working with you, you made me feel like I can just be myself and talk and do my usual thing. And then that it was going to come out and you're going to make it look so that patients are understanding what I'm doing and I look confident and, in my own skin. I thought that was amazing.
And I appreciate that. We talked about the importance of not just being in front of a camera and just saying things. Can you elaborate on like the quality of the work and the things that you see in the work that I provide?
There are multiple different aspects to working with you that the planning stage was really great. I think you provided just enough information and prompt for me to start thinking about what it is that I want to talk about without giving me way too much structure, in which case then I'm going to make it sound stiff and not my own. So I thought that pre-planning stage was very, very very key. Working with you on just the filming aspect of it, we got to film in multiple different spots just so that it becomes a lot more organic and it becomes more friendly in terms of, seeing me in different portions of our practice as well as where the patients are. And then watching it all to come together at the end, that was so much cooler than I had thought it would be, because it's not just somebody staring in my face talking the whole time. There are points that I want to make, and then you capture that, and then you kind of marry that together with a lot of the important, information and videography that comes along with it. And so you transition the two very smoothly in and out throughout the all the different talks, and I think that's pretty special.
Thank you. And talking about like this being a group, right? A vascular surgery group, how do you feel the content has helped the group?
The word branding gets used a lot, and I
Yeah.
think most of the time people have no idea what it means. I think people confuse, and I've certainly done that. I did not understand that there's a very distinctive difference between branding and just advertisement. And in the beginning, when we were trying to interview people and look for different companies to work with, we're just trying to find somebody that would be good at, reaching out to the community, advertising what it is that we do. But that's not about what branding is at all. Branding is, in some ways doing that, but it's helping us figure out what we're about and being able to display what our practice and what our core values and what our concepts are about, and being able to showcase that. And I think we were able to, one, learn that from you, and two, be able to actually come up with that within, even the first sessions that we had.
Last two questions. Where do you think you'd have been if you hadn't worked with us?
We would be a status quo, a little bit all over the place and a little confused. We would have still had no idea what branding is about and establishing identity of what we're about within this community.
If there's anyone who you think maybe is on the fence with, going through this process or working with us, or speaking with us, what would you say?
Oh, I think hands down, it's really great. And again, I didn't understand quite even the power of it, because even after I filmed and did everything, which the process was really fun and smooth, and so I enjoyed that part. But kind of looking to see what it did for my practice, all I was looking to see, how many people watched that view, or what are my patients actually watching, pre-surgery videos and commenting about it and learning from it. So I think I was looking at a very myopic view, but what it really does is it teaches everybody out there, puts the content into the internet, so people who have no idea what they're going through is able to then be connected to us through all of these contents. So it makes it fun and more specific and more easily reachable and palpable for patients.
100%. And I think it's always about the alignment of your expertise to the market, so people could understand and digest these types of procedures and how you can help them. Well,
and at the end, what we're hoping to utilize this is, we'll kind of organize the content, because some of it is, talking about like, veins and the differences, but some of them is actually education on what the procedure is about. So at the end, I'm sure we're going to line it up, and then we can just have patients watch some of this, so that I don't have to give the same talk over and over again and on the same day, which would be kind of cool. And then they get to have to watch it, meaning I get to give them a lecture, and then I get to have, Q&A a little bit more specifically for them. And that's what I'm kind of hoping, that it will also do a secondary involvement for us.
We'll make that happen. How do we use technology to be more efficient about how we work and how we communicate? So on that note, I want to thank you for taking the time to do this and to speak to my audience. And I appreciate you. And I look forward to seeing you and the group later on, actually the beginning of August.
Yeah, it's going to be super fun. All right.
Cool. Thank you very much.
It's good to see you again.
It's good to see you. All right. Cheers. See you soon.
Bye.
Bye.